We know residents in long-term care homes have been worst hit by COVID-19 in Canada. Almost 1/3 of Ontario nursing home residents who have died from it were living at facilities owned by just 2 corporate chains. That's one of the findings of a Global News analysis of government statistics, which use self-reported data from long-term care homes. Some unions and healthcare researchers say the numbers prove private care homes are more vulnerable to the novel coronavirus. As Ross Lord reports, others say there are other factors that can't be ignored.
Gestures of healing for families that lost loved ones in a nightmarish outbreak. As of June 12th, 70 residents had died from COVID-19 at Orchard Villa in Pickering, Ontario. Victims include 95-year-old George Morrison. His daughter is suing the care home's private owner.
We think it could have been preventable, the spread of COVID.
With the highest percentage of for-profit care homes in Canada, about 2/3, some of Ontario's private homes have been especially hard hit by the novel coronavirus. The 2 largest owners are Sienna Senior Living and Rivera Incorporated. In Sienna Homes, 295 residents have died from COVID-19. Rivera Homes have seen 230 deaths. 6 Sienna Homes experienced 20 or more deaths, compared with 4 Rivera Homes and 4 homes owned by another for-profit owner, Rika. 2 Sienna Homes had more than 50 deaths, as well as 2 Rivera Homes. Some researchers blame staffing. They say, in general, for-profits rely on temporary workers who move between homes to earn their living more heavily than their non-profit counterparts who hire more full-time, permanent staff.
Continuity of care makes a really big difference to the outcomes. So you have better care outcomes associated with more continuity. It's really straightforward.
But the industry is pushing back. The Ontario Long-Term Care Association says preliminary data shows a higher percentage of privately owned homes have no COVID-19 deaths. A statement from Sienna says the vast majority of our 70 residences across the country have experienced few, if any, cases of COVID-19. Rivera says there are many factors that play a part in why COVID-19 spreads, but that data has not shown ownership is one of them. Others say there's another key factor: design. Here at Northwood in Halifax, the virus has killed 53 people, and critics note the majority of long-term care residents here live 2 or 3 to a room, which could make it easier for the virus to spread. Northwood is a not-for-profit home.
Do we need to have all our nursing homes with single occupancy and a washroom for every resident of their own? That is the question that is really before us here in the province.
The question for everyone with a family member in long-term care: are they safe from the expected second wave of COVID-19? Ross Lord, Global News, Halifax.
We have a deeper look at long-term care home ownership and outbreaks of COVID-19. That's on our website, globalnews.ca/globalnational.